Welcome to the last of our presentations about the important roles of daily caregivers in providing age-friendly care to older adults in nursing homes and other long-term care settings. As we have said before, daily caregivers make a big difference in the quality of life and living of older people in their care by using the age-friendly framework. There are many opportunities to talk with older people as you provide assistance with daily cares. Talking to the person about their life, interest, and care preferences can help you learn what matters most to them, and in turn, you can help the person do what is enjoyable or important. When daily caregivers focus on quality of life for residents, they greatly increase the chances of improving their own quality of work life. In so many different ways, what is good for the resident is also good for daily caregivers. Today, we're going to think some more about goals and priorities in age-friendly care, which are to make sure older adults get the best care possible, that their care and treatment is based on what matters most to them. In turn, their health outcomes improve and risk of harm is reduced. These ideas are all important, and today we'll talk more about the role of daily caregivers in reducing the risk of harm. The main point is that older adults in long-term care settings often have multiple chronic health conditions, and their needs change over time. And during their stay, they may have new health problems diagnosed, their current problems may worsen, and new and existing problems may interact, including medication treatments. Daily caregivers spend the most time with residents and know their usual patterns really well. They are often first to recognize a change, that Mr. Jones isn't himself today, or Mrs. Smith is just not interacting as usual. You are often first to notice worsening symptoms or changes in abilities that signal risk of harm to the person. Recognizing and reporting these changes early reduces the risk of the person experiencing more serious illness and suffering. Your observations during daily care and sharing information with team members is critically important to early detection. As before, age-friendly care involves two main steps in change in status that include your observations and your actions. Observing changes from baseline or usual function is a main role for daily caregivers. Like delirium or depression, you are watching for changes that may signal a new problem that needs attention. Think about how the person may be different from their usual or baseline level of function. To help you do that, we highly recommend using the Stop and Watch tool to guide your observations. Then, act on your findings, documenting specific changes using the Stop and Watch tool or care notes. Talk to your team and supervisor. Share your concerns and help with further assessments if needed. Support any changes to the care plan, and review what matters most to the person to assure it fits their current situation and needs. Just like the name says, this tool is designed to help daily caregivers watch for common problems that signal change in status. These changes are characteristic of a number of different health-related problems, so further assessment is needed to know how long, often, and severe the symptoms are. You may help with that assessment, but your most important role is to notice the changes and talk with your supervisor and team. And as you think about all the areas in the Stop and Watch, don't forget to think about the interactions among the 4 M's of age-friendly care. Doing what matters often relies on the person's mobility, engaging in some physical activity every day to do what matters. Medications, avoiding medications that have adverse effects that interfere with doing what matters. And mentation, addressing dementia, delirium, and depression that are essential to well-being and doing what matters. Watching for changes listed on the Stop and Watch tool is just like watching for changes previously discussed in the mentation sessions. Ask yourself what behaviors might communicate or what might trigger them in dementia. Whether the person is more confused today than they usually are, that may signal delirium. And if sounding down or blue or being hard to motivate might be a part of depression. The goal is to be specific about what you observe, document it, and talk with your team members and supervisor so the next steps may be taken. In most cases, additional steps include further assessment and adjustments to daily care to assure safety and comfort. As changes occur, keep checking on what matters most to the person, particularly in their daily care routines and activities. Take time to talk with the person about what is important or would make today a good day. Ask what you or the team can do to help promote doing meaningful activities. In summary, daily caregivers are truly the eyes and ears of the larger care team and are often first to notice changes that signal a new or worsening health problem. Strong observation skills and knowing the person's usual routine and function helps detect changes from baseline. And using tools like Stop and Watch can help remind you what to consider and report. Documenting what you see and working with your team are essential to help reduce the risk of worsening illness. And as you think about changes in the person's health status, also check on what matters most today or now, which may also change. And as always, work to adjust daily care routines and activities to support the person's needs and doing what matters most. Next, I hope you listen to the What Matters podcast to hear about how age-friendly care positively affects residents, caregivers, and even nursing professionals.